Now, the difference in news and information. This is today's THB This Morning.
All right, thanks, Tom. Nearly 26 million children and adults in the United States have diabetes. 240,000 of those are right here in the state of Arkansas. So if you or someone that you love is battling this disease, it's so important to remember that diabetes also brings with it a higher risk of developing certain eye diseases. Pretty interesting. Dr. Lydia Lane with Little Rock Eye Clinic is here this morning with details. Thanks for being here, Dr. Lane.
Thank you, Elise.
We appreciate having you here on this Medical Monday. So what are some of the types of eye diseases that can affect those with diabetes?
Well, if you have diabetes, you're at an increased risk for what we call diabetic eye disease or diabetic retinopathy. What that means is there are tiny little blood vessels in the back of the eye and the retina, and they can leak. They can leak fluid and proteins. If this happens, it can cause a permanent vision loss. So it's very important for you to have diabetic eye screening exams with your eye doctor to look for this. You're also at a higher risk for cataracts, glaucoma, and retinal detachments if you have diabetes. So very important to have an eye exam to look for all of these issues and so they can be managed.
Okay, you keep mentioning this eye exam, so obviously we know how important that can be, but what all does that entail?
If you have diabetes or if you've been initially diagnosed or you have diabetes and had it for some time, then it's recommended that you have a diabetic eye exam. And what will happen is that you'll go in and to your eye doctor, you'll have a vision test. They'll look for glaucoma, they'll look for cataracts in the front part of the eye, and then they're going to dilate your eye. It's a very simple, painless procedure. They'll use eye drops to get a very good look at the retina in the back of the eye, looking for any of the swelling or leakage, which I mentioned earlier.
It seems like it's very important to go ahead and get that screening because you never know what they could end up finding, and I'm sure that early detection is so important when it comes with this. But what are some of the other things that people with diabetes should do to help reduce their risks?
At the Little Rock Eye Clinic, the physicians always recommend tight blood sugar control. That's the #1 thing that you can do to help prevent having issues in the back of the eye, cataracts or glaucoma associated with diabetes. If you smoke, it's a good time to consider stopping because that does increase your risk for all of those issues as well.
Okay, and we're definitely talking about what those with diabetes should do as far as their eye health is concerned with those screenings. But what if you don't have diabetes? Is it still important to come in and get checked out for those things?
It's important to have an eye exam at least once every 2 to 3 years if you're young and healthy, and then at the ages of 64 and up, we usually recommend once a year. That's when cataracts and glaucoma and other retinal issues become more prominent. So it's important to have an eye doctor and continue with screening exams on a regular basis.
All right, and where are you guys located?
We're located at the Baptist Eye Health Building. Off the Baptist campus.
All right, so make sure that you go in and check them out if you have any questions regarding your eye health. So important to get checked out for that and make sure that they can keep you healthy and seeing well. Right, Dr. Lane?
That's right. We'll be happy to see you.
We appreciate having you here today. Thank you for coming in.
Thank you.